Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, and with me today is our public health nurse, Lindsay Wright, and our health director, Marty Golightly. How are you guys?
Hey, what's happening? Happy Friday.
It's been an eventful week, I'm sure. So let's start off with what's hopefully the good news, our current COVID numbers.
Yep, I'll throw
Great
it over
news there. We have 10 active cases. That means 1,994 have been removed from tracking, and we have 8 residents in quarantine.
We're so close to single digits again.
Nice.
I think October was the last time we were, maybe September, last time we were single digits.
Wow.
So that's nice. Keep up all of the hard work and keep getting vaccinated.
And speaking of vaccination, so I see we have good news with the Pfizer vaccine being okayed for 12 to 15, and I believe there's a clinic next week at the school.
There is. We actually did a clinic this week at the school for 16 and overs with Pfizer. Next week we're going to do. It's almost 150 now. And we expect it to be in that neighborhood on Wednesday of next week from 2:30 to about 4:30. We're probably going to extend it because we didn't expect it to be this popular, and we're very happy that it is. And if if a parent of a kid in the district who hasn't, please email me, Lindsay, or the nurse, the school nurse, Sarah LaPointe, and we will get you on the list. Also, if you're a parent who's on the fence and is now eager to get vaccinated because it'll be literally in your backyard and your kiddos are going to get it anyway, come on down. We'll sort you out. No judgment here. We'll happily vaccinate anybody who would like to be vaccinated in town, and we're proud to be able to deliver it in town, in school, where people are, as it should have been a long time ago, in my humble opinion.
Nice. Now that things are getting better, we finally have access to what we've needed all along. So
Imagine that.
Yeah, that's a plus. Hey, we're not going to complain.
I'll take it. I mean, and hopefully this is an indicator of things long term. They're going to move back into the smaller venues for shots like this. Also, I'm sure a lot of the residents have access to their primary care physician now has access. So check with them if you have any questions. If you have any questions about the vaccine, call us. If I can't answer it, I promise you I know a nerd who can. We'll do everything we can to get the population as vaccinated as possible.
Awesome. So the other thing I thought it would be helpful to talk about today is, and I know we predicted this months and months ago, we are entering into that weird gray period right now where guidance is not as clear as things are starting to get better. So the CDC made an announcement this week that they're changing their guidelines, saying fully vaccinated people don't need masks indoor or outdoor. But the CDC is guidelines, not mandates, correct? Recommendations.
Yeah, the CDC recommends that mask restrictions be loosened up, and I fully expect the Massachusetts Department of Public Health and the governor, the Baker-Polito administration, to adhere to that recommendation. And I expect I know the Bakers put out something already, that a statement will be given early next week, Monday or Tuesday. We have a local health department and board of health call on Tuesday, so it would not shock me that if it is on Tuesday and then local guidance is subsequently given. So I would expect early next week that Massachusetts will adopt some form of the easing of those restrictions. I would not be surprised if opening the state up as a whole is expedited sometime next week as well. Mm-hmm. So, but in this weird interim, I want to ask that if you're not vaccinated, especially, please continue to wear your mask. There's no easing of restrictions in Massachusetts currently. If you're in an establishment, you still have to wear your mask. And even if they do get rid of the mask mandate, it will still be wise for unvaccinated, medically fragile people who have to go out, continue to wear a mask. Also, if you have symptoms, and even if you're vaccinated, it would still be helpful if you wore a mask to protect others from you, not the other way around. That's just common sense. pretty normal in other parts of the world for when someone wakes up and they have the sniffles or the sneezes, they put on a mask because it helps protect. It's for the public good. It's to protect your neighbor. It's not some indication of whether or not you are somehow less. It's just a nice thing to do.
Help others, help yourself.
Yep. I want to say thank you to our Bridgewater State University. Go Bears. They are the ones that set up the regional collaborative, and they are the ones that we were able to partner with to be able to deliver Pfizer vaccine, not only to our community, but to a lot of the other communities. So before I forget, I want to say that is my alma mater, and they've been great.
Thank you, BSU. On the mask thing, I know there's some confusion, or people do get confused sometimes. So I just want to be clear on a few things. So the mandate is still in place. Do you know offhand? So Abington, we adopted a mask mandate prior to the state. If the state lifts theirs, does ours go automatically, or is the Board of Health going to have to lift that themselves? Do you know?
I believe the board will have to lift it themselves, but generally speaking, I believe the board has kind of followed suit
with whatever the state's doing.
And we can discuss that at our Monday night meeting in the Meyer Room in Town Hall at 7 o'clock. All are welcome. Board of Health meetings are not typically as popular as planning or the selectmen meeting. So come say hi.
Yeah, come say hey, we're there. Just don't steal our chairs.
Yeah, Lindsay, you want to talk about the babysitter course for me real quick for us, and then let everybody know what's going on with that?
Yeah, so we have the first course coming up in June, and that is full, which is so exciting. And then we added a second class in July, the 12th and the 13th, I believe it is. We'll be at the library. We do have a few spots left, and so if you are interested in signing up, it's geared towards 11 and older. We're going to do it over 2 days, 2 to 6 each day. And the kids will leave with their babysitter's certification, as well as a 2-year pediatric CPR and first aid certification. So very exciting. And they can get in touch with me or Marty, and we can get them on the list. Unfortunately, just because of Red Cross regulations, we have to cap it to 18. But so we do have a few spots left of July. And if there's more interest, we can keep adding classes.
I did have a question from a resident, and I meant to address this earlier about the CPR training that you guys are offering in general. Is that going to be limited to Abington residents?
I would say if there is an Abington resident who wants the course and we are full, I would be willing to bump a Rockland resident to make room for them. But I would happily have a Rockland resident or a Brockton or anywhere, as long as we have room and availability.
Awesome.
But I will bump for let's take care of us first, all right? Then we'll get everybody else.
Yeah, that's it. It's okay. Thank you. Yeah, that was asked, and I promised to address it. So, Ellen, I apologize for taking so long to get to that, but there you go.
Also, we're going to be offering quite a few classes coming up, relatively soon. We want to do wilderness medicine. I forget what it's actually called. Lindsay, help me out. Wilderness
and remote first aid.
That's what it is. We'll be doing that one. We'll be doing adult and kid CPR. We'll be doing as many as we can, as many as there are interests for. And a lot of this is on me and Lindsay's spare time, because we don't work at 6 o'clock at night. We do. But so we are charging only what the Red Cross has us charge, just to cover the cost of the course, cost of materials. This is a service that I think is beneficial to the public health, and we will continue to do it as long as we can.
Awesome. You're going to be camping with the wilderness first aid?
No, but I am an adventure racer, so I utilize those skills myself, and I am not a camper. I am a glamper.
Yeah.
I'll go camping I'll go camping.
Awesome.
You guys forget, I was with the Marine Corps for 14 years. My camping days are done.
They're done. Nice. All right. So we get exciting courses coming up. Vaccination clinic for our youth next week. Numbers are trending down. So it's a good report this week. This is good news.
It's a far cry from our December. There are There are 800 cases in town. Please God, everybody wear a mask. Like, I hope this trend continues. I hope someday in the future we're just talking about Red Cross courses and how great the new trash contract is. Like that's the dream. I do want to throw. Speaking of camping and adventure racing, tick season, mosquito season. Wear your insect repellent when you're in the woods. I'm looking at you, Chris.
Yes, and and my scouts can tell you, I can't emphasize enough. Check yourselves for ticks. It takes 24 to 48 hours for them to be on you to transmit Lyme disease. So the more often you check and get them off of you, the better. And for the love of God, don't put Vaseline or use a match to get a tick off of you. There is one way to remove a tick, and that's with tweezers. Quick pull. So I've seen that floating around Facebook lately. So
please don't do that.
I always said, if somebody lights your butt on fire, which direction are you going to go? You're going to go the opposite direction. So not good. All right. Well, I think that's all we have for this week. The only other thing I wanted to touch on with masks, and I'm sorry to keep harping on this, but I'm just anticipating some confusion. Just a reminder to people that businesses are private property, and regardless of what the state or federal mandates are, if a business chooses to require masks, that is their right. So please be respectful and don't give the employees a hard time.
Yep. Be nice. Rule number 1.
With that said, that's it for tonight. We will hopefully see people at our Board of Health meeting on Monday. And if not, we'll catch you on the next Health Department Roundtable.
Town meeting very soon. Don't forget, town meeting very soon.
Town meeting, yes.
Everybody come out. May 24th, 7 o'clock, Abington High School. It's, we'll be able to do it safe. And I can't believe I buried the lead. We're doing a free walk-in.
I was gonna say.
Yeah.
That night, 5:30 to 6:30. If you still haven't got the vaccine and you were just waiting for it to fall into your lap and say, "Oh my gosh, somebody stabbed me in the arm," all of a sudden, we will happily be those people for you. 5:30 to 6:30 prior to town meeting, May 24th. The town meeting starts at 7. All the information is on the town meeting special town warrant link that our moderator sent out. Sorry, that was the last thing, Chris. I didn't want to.
I'm glad you mentioned that. I forgot that. And offhand, do you know which shot you'll be giving on that day on the walk-in?
Most likely Pfizer, but we might have some Moderna too. It might be a smorgasbord of whatever. It might be a dealer's choice. Do you want Johnson & Johnson for one series? We might be able to accommodate you that. Because we've gone from please give us vaccine, I will literally do anything, to we have you know a guy? Do you know a guy?
It's a great problem we have. It's a far cry from February when we were begging for vaccine.
All right.
Awesome.
So, yeah, come on out. We'll get your shot.
And as always, if you're looking for information, check with the Health Department or the Board of Health's Facebook page. Feel free to contact us with any questions and anything that you would like to see us address on our weekly roundtables. We'll be happy to bring up. So, thank you, everybody. Have a great weekend, guys. Thanks again for joining me.
Have a great weekend.
Bye, everybody.